All right, I'm live. So, I'm sure you all heard of the news of the federal government like making the jabs mandatory for the public sector for like public sector workers. Um, but apparently there's like some exemptions now. So I'm gonna pull up an article, so which explains it all. So So this is an article from the Western Standard, and it says 2/3 of federal civil service will be exempt from mandatory jobs. So it says exempted exempted employees include call center operators, federal judges, meat inspectors, park wardens, postal workers, auditors, commons and senate staff, soldiers, sailors, and air crew, and members of the public entering federal buildings. Wow, well, that's that's a lot of exemptions there. So it says the mandatory job plan of 300,000 federal workers actually exempts 2/3 of the civil services. Blackhawks reporter. The JAB program will also work on the honor system and doesn't require JAB papers. Exempted employees include call center operators, federal judges, meat inspectors, park wardens, postal workers, tax auditors, commons and senate staff, soldiers, sailors, and air crew, and members of the public entering federal buildings. The Canadian public service is vast, said Deputy Prime Minister Chrystia Freeland. We are Canada's biggest employer. Prime Minister Justin Trudeau on September 28 proposed a blanket policy on compulsory jobs. We are going to ensure the federal public service is jabbed, he said. There is a clear requirement for the shots for anyone who works for the federal government. The federal public service numbers the federal public service numbers three 300,540. The Treasury Board and a policy on COVID-19 jobs said there will be numerous exemptions covering some 212,000 employees. The policy applies to all public servants and the core public administration, an official told reporters at a Treasury Board press briefing. The distinction exempts employees of Crown corporations such as postal workers and staff at federal agencies such as meat inspectors with the Canadian Food Inspection Agency. RCMP. Um, then it says RCMP border agents and prison guards are included. Parks Canada wardens and the Canadian Armed Forces are excluded. Workers at federal departments that deal directly with the public and cannot be short staffed are exempt, such as employees of the Department of Veterans Affairs, staff who manage staff who manage call centers for benefits claims at the Department of Employment, and tax processors and auditors at the Canada Revenue Agency. The Treasury Board said employees in core public administration who are included in the order can comply by filing an electronic statement claiming they are jabbed without proof or claim an exemption under the Canadian Human Rights Act on religious or medical grounds. Why not ask for proof? Said a Treasury Board official who asked not to be named. Provinces and territories are responsible. If we have to show proof of getting the jab to enter a restaurant, why is the government of Canada not expecting to have the same policy? Asked a reporter. They are asked if they have received their jab. They are asked if they have received their jabs, replied an official. The largest federal union, the 160,000 member Public Service Alliance of Canada, said the policy was announced without meaningful consultation, and the Treasury Board gave unions less than a single business day to provide feedback. Then it says how it is applied matters. The alliance said in a statement, "We know increasing jab rates is the best and most reliable way to slow the spread of COVID-19 in our workplaces and our communities, and encourage our members to be encourage our members to be jabbed. However, if the goal is to keep the workplace healthy and safe, this policy still falls short." So that's the end of the article, and so 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 the government, they're actually like giving exemptions to like 2/3 of the federal civil service. So it's like on one hand they're saying that they're making it mandatory for everyone in the public sector to get jab, but at the same time they're also like putting out like exemptions for, I guess, different departments in the public sector. So it's like it's like there's no consistency with what they're doing with all these like job mandates. So that's the end of this article, and now now I want to pull up another article, but this time it has to do with traveling and how like whether you've been jabbed or not, like whether that like affects you, whether it affects your ability to travel or not. So I'm gonna like pull up another article, this time from CBC. So um, so here's an article from CBC. It says, fully jabbed and ready to travel abroad, you might still face hurdles. The federal government still advises against non-essential international travel. So it says, when the federal government announced in early July that fully jabbed Canadians traveling abroad can skip quarantine upon their return home, some travel-starved people started making vacation plans. But traveling abroad during the pandemic is still complicated and not yet recommended by the government. Here's what you should know before planning your long awaited trip. Should I stay or should I go? Since the start of the pandemic, the government has advised against non-essential travel abroad. The Public Health Agency of Canada, PHAC, told CBC News it loosened restrictions for fully jabbed travelers because Canada's COVID-19 situation has improved. But PHAC says the government still advised against international travel because some countries currently have high infection rates and COVID 19 variants remain a concern. The Public Health Agency also warns that travelers could face problems if their international destination suddenly imposes a lockdown. Canadians may be forced to remain outside of Canada longer than expected. Spokesperson and Genier said in an email, Canadians should not depend on the Government of Canada for assistance related to changes to their travel plans. And epidemiologist Nazim Muhajarine suggests Canadians consider the COVID 19 situation both at home and at their destination before making travel plans. So I guess this is a picture of him, the epidemiologist. So then it says, we have to be very careful, said Muhajarine, a professor of community health and epidemiology at the University of Saskatchewan. There are many places in the world where COVID 19 is still very much a threat. Muhajirin was set to fly to Mozambique this fall to work on a community health project, but he said he decided to cancel his trip because both Mozambique and his home province currently have high COVID 19 infection rates. We are in the middle of a fourth wave, a Delta variant wave in Saskatchewan, said Muhajirin. I don't think that I don't think that even though I'm fully jabbed, I should be traveling. Then it says mixed jab woes. Like Canada, many countries now allow fully jabbed travelers to skip pandemic-related entry requirements, such as a mandatory quarantine and or a COVID-19 test. But travelers need to make sure the COVID-19 jab, um, the COVID-19 jab they received is accepted in the country they plan to visit. Some countries don't recognize people with mixed jab doses as being fully jabbed, a potential problem for the millions of Canadians who received shots of two different jabs. Yeah. So some countries they might not accept two different like doses of the jab. So if you've taken like for example like one Moderna jab and another like Pfizer, then if you were to go to like another country, then they might not accept like two different doses of you. They might not accept that you've taken two different doses of the COVID jab. So yeah, that's another thing to keep in mind. And so then it says Canada says it's working with other countries to resolve these differences, and there's been progress. Barbados, England, and Northern Ireland recently changed their policies to now accept mixed doses. However, neighboring Republic of Ireland still does not. We are hoping that this will change very soon, Tourism Ireland spokesperson Jocelyn Black told CBC News in an email. Then here's a picture of two travelers. It says John and Ingrid White of Toronto are set to fly to Florida in November to spend the winter at their condo in Naples, Florida. The snowbirds are waiting to see if the U.S. will accept them as fully jabbed after receiving doses of two different jabs. Although there are some exceptions to the rule, the United States currently doesn't recognize mixed doses. That position sparked concerns when the U.S. announced last month that starting in early November, foreign air passengers entering the country must be fully jabbed. I feel blindsided, said Ingrid White of Toronto. She and her husband John each have one dose of Covishield, a brand of AstraZeneca, and a second dose of Pfizer. The snowbirds are booked to fly to Florida on November 17th, but now they're worried they might not be able to enter the U.S. due to their mixed jabs. We don't really know what to make of the situation, said White. The U.S. Centers for Disease Control, CDC, told CBC News this week it's still hammering out the details of the upcoming jab requirements for air travelers, including the list of accepted jabs. The CDC said it will provide more details in the coming weeks. Meanwhile, Canada says it's providing the U.S. with data showing the effectiveness of mixing jab doses. We are hard at it, said Chief Public Health Officer Dr. Theresa Tam at a news conference on Friday. We have left no stones unturned. So rather than waiting it out, White wants to resolve her problem now by getting a third jab dose, so she would have two doses of the same jab. We're running out of time, she said. However, Ontario doesn't provide third doses to travelers. The province said it's following federal guidelines that currently only recommend giving third doses to certain people with compromised immune systems. Despite the recommendation, Quebec, Manitoba, Saskatchewan, and Alberta each offer third jab doses to people in their province who need it for travel. Nova Scotia says it will start offering third doses on October 15 to people who need it to travel for work. Then it says, what about travel insurance? What about travel insurance? Travelers can now get COVID 19 medical coverage, but that won't cover all pandemic related problems. Travel insurance broker Martin Firestone said it's possible to get cancellation coverage in case you get COVID 19 and must cancel your trip, but he said you likely won't be covered if you cancel your plans for other pandemic related reasons because COVID 19 is now a problem, known in court. If your reason is going to be because of a shutdown, a fifth wave or sixth wave or seventh wave, you're out of Firestone, who works for Travel to Canada from their trip. Travelers must show proof of a negative COVID 19 test. Firestone also warns that some COVID 19 medical coverage plans don't include costs incurred if positive and must stay longer at your destination. That said that type of coverage known Firestone said that type of coverage, known as trip interruption insurance, typically includes a daily cap, so even if you purchase it, you may not be covered for all your expenses. You could be staying at a $1,000 a day hotel. That does not mean they're going to cover your costs at the hotel for 14 days, he said. All that any of these products could do would be to offset some of your costs. Canada still advises against all cruise ship travel. As a result, Canada still advised against all cruise ship travel. As a result, many insurance providers won't offer COVID 19 medical coverage for cruise ship passengers. Will McAleer, executive director of the Travel Health Insurance Association of Canada, says that at least a couple of providers offer this type of coverage for jab travelers, and no cruise ship passenger should leave home without it. If I get sick, I could be talking about a helicopter air evacuation off of the front of the ship at sea. To a port, to an air ambulance, to a center that can look after me, he said. So it could be quite complicated and costly. McAleer said all travelers need to do careful research before purchasing their insurance plan to make sure they have the right protection during the pandemic. Shopping around is the key for consumers at this point. And so like that's the end of this article. So even here they're saying even the insurance companies like they might not be able to cover like people who have been jabbed. So so yeah, even in this art, so even like even the insurance companies are saying how they're not going to be able to cover like people who've taken the jab. So if they end up getting into some type of issue abroad, then the insurance companies like they might not be able to help them out as well. So and also says here many insurance providers won't offer COVID-19 medical coverage for cruise ship passengers. So even if you're traveling by a cruise ship, then many like insurance companies they won't offer any medical coverage. So yeah, I so yeah, I hope yeah, I really hope people like think start to think think twice about like taking these jobs because because if they decide to travel abroad, then they won't be covered by these insurance companies. So even if you're traveling by cruise ship, like you won't like be able to get like medical coverage for COVID-19 if you were to have any type of issues. So and also like other countries like they may not like recognize people who've taken like two different jabs. So if you've taken like one Moderna jab, for example, and another Pfizer, then if you try and go somewhere, then they might not be able to. Then might not recognize that. So I hope like people start like looking into what they're getting themselves into if like by taking these jabs, and also like if they decide to travel, as they might not as they might not have access to insurance and all that if they run into some type of issue abroad. And also like some countries they don't recognize like mixed doses. So if you've taken like two different doses, then you might not be able to travel to another country because they might not recognize that. So yeah, I hope yeah, so I hope like people really start thinking about that and start looking into it. So yeah, that's everything I had to show. That's everything I have to say, and I'll be signing off.